Imagine this. A 71-year-old retired mail carrier named Walter stands in the doorway of his bathroom, staring at the toilet and quietly thinking, "Is this how the rest of my life is going to be?" Walter used to walk miles a day delivering mail, but now his schedule seems controlled by his bladder, constant urges, slow stream, and those exhausting nighttime trips. In today's video, viewers follow Walter's journey as he learns 5 simple, low-impact exercises that help him regain control, reduce those urgent bathroom runs, and feel more confident about his prostate and bladder again. And here's the big question this video keeps coming back to. If a man like Walter can make a real difference with just a few minutes of movement a day, what might these same exercises do for someone watching right now? Before anything begins, a gentle reminder appears on screen. This video is educational and not a substitute for your doctor's advice. Always check with your healthcare provider before starting new exercises, especially if you have heart disease, joint problems, or prostate cancer treatment history. From the outside, it just looks like more trips to the bathroom. On the inside, for many older men, the story often involves a gland called the prostate slowly enlarging over time. As that gland gets bigger, it can press on the tube that carries urine out of the body, which is why the stream can turn from strong and steady to weak, hesitant, or stop and start. Doctors often call this benign prostate enlargement, or BPH, non-cancerous growth that can still cause a lot of trouble with sleep, energy, and daily life. Here's the encouraging part. While exercise cannot magically melt the gland away, research suggests that specific movements and overall physical activity can ease urinary symptoms, improve bladder control, and sometimes lower the chance that symptoms get worse over time. In this story, Walter doesn't fix everything overnight, but he starts to understand that his muscles, his breathing, and his daily movement can work together with his doctor's plan to help him feel more like himself again. Here's what Walter's doctor told him very clearly. Exercises are not magic, and they don't replace proper medical care. They usually do not literally shrink the prostate like turning down a dimmer switch. What they can do is powerful in a different way. Strengthen the pelvic floor muscles that help hold urine in until a person is truly ready to go. Improve overall circulation and weight control, which is tied to better urinary health in older men. Support the body's ability to manage inflammation and age-related changes that play a role in lower urinary tract symptoms. That's the realistic promise of this video. Not a miracle cure, but 5 practical, gentle moves that can help someone like Walter work with his body and his doctor, instead of feeling completely at the mercy of his bladder. Viewers are encouraged to grab a sturdy chair, a glass of water, and maybe a small towel. By the end of the video, they'll have a simple home routine they can repeat daily. The first move is so subtle no one in the room will even know you're doing it, yet it can change how you pee. Walter is about to learn an exercise many men wish they had discovered 20 years earlier: pelvic floor activation, sometimes called Kegel-type work for men. To find the right muscles, imagine the muscles you would squeeze if you were trying to stop passing gas or trying to stop urine midstream. Try to do this without tightening your belly, buttocks, or thighs. Walter practices this by gently closing those deep muscles for just 2 to 3 seconds, then relaxing fully. Starting position: sitting upright on a chair, shoulders relaxed, feet planted. Hands can rest on the thighs, jaw loose, and face soft. Walter gently squeezes those deep muscles as if lifting something small inside his pelvis. Hold for 3 seconds, and now, follow along for 8 to 10 gentle lifts in a row. Now, completely let go for 5 to 6 seconds. It's important to relax the muscles fully between each lift. The pelvic floor forms a sling of muscle under the bladder and bowel. Strengthening it can help reduce leakage and urgency. It also helps with post-urination dribbling, which many men find frustrating but manageable with these exercises. Walter's starter goal is 1 to 2 sets of 8 to 10 gentle squeezes per day. Consistency is the key to building strength. Over several weeks, the aim is to work toward holding each contraction for 5 to 10 seconds. Always avoid breath holding or straining. In a clinical study, men who combined pelvic floor work with medication felt bigger improvements in urgency than those using medication alone. A vital safety note: do not practice stopping urine mid-flow regularly, as that can confuse the bladder over time. This test is only for identifying the muscles once with a doctor's guidance, not for your daily training routine. Could the way someone breathes really change how often they run to the bathroom? Walter has lived most of his life breathing up into his shoulders, especially when stressed. Now he's learning that deep, slow belly breathing can calm the nervous system. Deep belly breathing doesn't just help you relax, it gently relaxes the muscles around the pelvis, which is crucial for bladder control. Let's start with hand placement. Place one hand over your chest and the other over your belly, just above the navel. Inhale slowly to a count of 4. Feel your lower hand rise with the breath, while your upper hand stays relatively quiet. Keep your chin relaxed and make sure your shoulders don't hike up toward your ears. Focus entirely on that belly movement. Now let the air slowly escape through pursed lips to a count of 6. Feel your belly fall back toward the floor. On each exhale, imagine the area between your pubic bone and tailbone softening and melting into the mat. Think of it like setting down a heavy grocery bag after a long walk. Just let that tension go completely. We'll practice this together. Inhale, 2, 3, 4, and exhale, 2, 3, 4, 5, 6. Aim for 8 to 10 of these slow, deep breaths. This simple routine can take just 2 to 3 minutes, but makes a huge difference. Stress and anxiety tend to tighten pelvic muscles, which can worsen urgency and frequency for many men. Gentle breathing helps balance your nervous system and works alongside your doctor's plan to manage your symptoms. Walter's smartwatch even shows a gradual drop in his heart rate as he practices this. Tangible proof that his body is settling down. This next move looks like a tiny motion of the hips, but for Walter, it's like oiling a stiff hinge. Walter now lies on his back with his knees bent and feet flat on the mat, hip-width apart, arms resting at his sides. Walter starts with a small natural space under his lower back. This is the neutral starting position for the pelvic tilt. On a slow exhale, he gently presses his lower back toward the mat, tipping his pelvis so that his belt buckle would tilt slightly toward his face. On the inhale, he returns to the starting position without forcing an exaggerated arch. The motion is small and controlled. Viewers are guided through 10 to 12 of these small controlled tilts, syncing each move perfectly with the breath. From the same starting position, Walter presses his feet gently into the mat and lifts his hips just a few inches, forming a soft diagonal from shoulders to knees. He holds this position for 3 to 5 seconds, breathing steadily, maintaining that light activation in his core and glutes. He then slowly lowers his hips back down to the mat. The goal is 8 to 10 of these small, focused bridges. Viewers with back pain are reminded they can stay at the pelvic tilt stage or lift their hips only an inch or 2. These movements help keep the lower back, hips, and pelvic region mobile, supporting better pelvic floor function. Strengthening the gluteal and core muscles supports posture and helps reduce strain around the bladder outlet. In a moment, Walter will learn 2 stretches that took his bedtime bathroom visits from 4 trips down to just 1 on many nights. Stick around, because the way he sequences them before sleep might surprise you. Tight hips can pull on the pelvis like a short bedsheet. What happens when they finally get a chance to lengthen? Walter stands beside a sturdy kitchen counter or chair for support. He steps his right foot back about 1 stride, keeping toes pointing forward. Keeping his torso tall, he slowly bends the front knee, feeling a gentle stretch across the front of the right hip and upper thigh. He avoids leaning forward at the waist. Instead, he imagines his chest floating up to maintain a long, neutral spine. He holds this stretch for about 20 to 30 seconds, breathing deeply into the belly, then switches to the other leg. Next, Walter sits on the edge of a sturdy chair, feet flat on the floor, ready for the seated figure 4 stretch. He crosses his right ankle over his left knee, creating a gentle figure 4 shape with his legs. Keeping his spine long, he leans very slightly forward from the hips until he feels a stretch in the hip and buttock. No bouncing or rounding. He holds for 20 to 30 seconds, breathing steadily, then switches sides. This helps release deep tension in the hip rotators. Many men live with tight hip and lower back muscles from years of sitting, which can contribute to pelvic discomfort and poor posture. Gentle stretching decreases tension in areas that share connections with the pelvic floor, supporting more comfortable bladder control. Walter makes this part of his evening routine, right after brushing his teeth and just before his final bathroom visit of the night. Over a few weeks, he notices his hips feel looser and he's more relaxed heading to bed, which seems to help with fewer wake-ups. Walter didn't sign up for a gym, he just changed how he walked to the mailbox. Walking is one of the simplest, safest, and best-studied forms of exercise for older adults, and it can be a powerful ally for urinary and prostate health. Walter's goal is not a marathon. He works up to walking most days of the week, aiming for at least 30 minutes total per day, often broken into 10-minute walks after meals. The target is a pace where he can talk but not sing easily. It's about effort level, not just exact speed. Walking regularly helps manage weight, blood sugar, and cardiovascular health, all of which interact with your prostate and urinary function. Studies suggest that men who walk regularly tend to have a lower risk of developing bothersome prostate enlargement symptoms. Walter didn't start with 30 minutes. At first, he could only do 8 minutes. Over several weeks, he added a couple of minutes each time, building his stamina and confidence. Coming up next, viewers see the exact weekly schedule Walter uses, how he fits all 5 exercises into his mornings and evenings without feeling like he's working out all day. If you feel overwhelmed, the next section breaks it all down into easy building blocks. You've got this. If a plan takes more than a sticky note to remember, Walter won't do it. So here's his one-page blueprint. Morning starts with 5 minutes of breathing and pelvic floor work. After waking up, Walter does 8 to 10 slow breaths, then 1 to 2 sets of gentle pelvic lifts while sitting. Next is a 5 to 7 minute walk, just to the end of the street and back. If the weather is poor, a few laps around the living room work just as well. After lunch, Walter does a few pelvic tilts and 4 to 6 bridges. Then he walks around the house for a few minutes, especially if he's been sitting. Evening is for winding down. Walter performs his hip flexor and figure 4 stretches for 30 seconds each side to release the day's tension. About an hour before bed, he takes a slow 5-minute walk indoors to help circulation, followed by one last relaxed bathroom visit and several calm breaths. Combining strengthening, stretching, and aerobic activity aligns with research showing these methods improve urinary symptoms and overall function in men with BPH. Remember, even doing half of this routine most days is better than doing nothing. Tiny steps still count toward regaining your confidence. The first time Walter slept 5 hours straight without getting up, he almost didn't believe it. In the first week, Walter felt doubtful. His bathroom trips didn't change much, he forgot a few sessions, and he honestly wondered if it was all worth it. By the 3rd week, though, he noticed small wins, like having a night with only 2 trips instead of 4. He felt less rushing to the bathroom in the afternoon, and more control over his day. He even felt a little more confidence when going out for coffee with friends, no longer scanning for the nearest exit. Walter didn't wait to be motivated every day. He tied his exercises to things he already did, after brushing his teeth, after lunch, or before his favorite TV show. That way, the routine became as automatic as putting on his slippers. It wasn't a chore, it was just part of his day. Think of 3 daily habits you already have, like making coffee, checking the mail, or watching the news. Mentally attach one exercise to each right now. Pause the video if you need to, write those down, and then we'll continue. This is how you make real change stick. There are times when pushing through is dangerous, not brave. Understanding your body's limits is the most important part of any routine. Talk to your doctor promptly if you notice new blood in your urine, burning or severe pain, an inability to urinate at all, or a sudden worsening of your symptoms. Also, watch for unexplained weight loss, bone pain, or a general feeling of being seriously ill. These require professional medical attention right away. If you experience chest pain, severe shortness of breath, or dizziness during walking or exercises, stop immediately and contact your physician or emergency services. The same applies to increased pain in your back, hip, or groin that lasts after you've finished your stretches. Listen to what your body is telling you. Men with known prostate cancer, recent surgery, or advanced heart or lung disease need personalized guidance on exercise intensity from their medical team. Walter brings his new routine to his doctor. They work together, treating exercise as one vital part of a bigger plan, including medication and bladder training. Together, they've turned Walter's journey into a success story, one tiny step at a time. Thank you for watching. If someone watching remembers nothing else, these 5 simple ideas are enough. First, invisible pelvic lifts. These strengthen the sling of muscles that support the bladder and help you regain control over urine flow. Second, calming belly breathing. It lowers stress and teaches your pelvic floor to relax instead of staying clenched throughout your day. Third, pelvic tilts and gentle bridges. These keep your lower back and hips mobile while building vital core and glute strength. Fourth, hip and low back stretches. They release tension in muscles connected to the pelvis, making sitting, standing, and walking more comfortable. Finally, regular walking. It supports weight, circulation, and heart health, which can lower the risk and severity of your symptoms over time. Remember, progress is gradual. Some days may feel like setbacks, but over months, these practices combine to make your journey less stressful. They give you a better sense of control and confidence in your own body. Thank you for following Walter's story. Imagine 3 months from now, not planning life around every toilet on the map. Walter still has an enlarged prostate and still sees his doctor. But now, he has 5 practical tools he uses every day to feel in control again. If you recognize yourself in Walter's story, tired of sprinting to the bathroom, tired of broken sleep, this is your moment to act. Step 1. Talk with a healthcare provider about your symptoms and ask whether these 5 gentle exercises are appropriate for your specific situation. Step 2. Pick just 2 moves to start with and tie them to existing habits so they're almost impossible to forget. Step 3. Come back to this channel, Wise Nourish, and watch this routine again while following along to perfect your form. If this was helpful, please hit the like button so more seniors can find us, and subscribe to Wise Nourish for more science-informed health guides. Share in the comments what your biggest challenge is right now: urgency, nighttime trips, or something else. Your feedback helps us shape future videos. Take that first tiny step today. Thank you for watching, and we'll see you in the next video.